Hello, I'm State Representative Anne Gonzales from the 19th House District. Welcome to Ohio in Focus.
Hello, and welcome to this edition of Ohio in Focus, a program that brings state government to you. I'm your host, Carolyn Best. We have with us today State Representative Anne Gonzales, who serves the 19th House District, which includes Westerville, Sharon, Minerva Park, Blendon, Plain, New Albany, Mifflin, and Gahanna. Thank you, Representative, for joining us today.
Hey, thank you, Carolyn. Thank you for having me.
You're welcome.
It's a joy to be here.
Good. Well, now that the budget has passed,
Right.
Can you tell us a little bit about, what your projects are this summer, maybe some things that are going on within your community and your district?
Well, we are keeping very busy this summer. We are really trying to focus getting back in the district and connecting with people. And we've been doing that through district office hours that we have been hosting in Westerville, New Albany, and Gahanna at the libraries. We are continuing to do ribbon cuttings, and we're sponsoring some events. We're sponsoring the Westerville Chamber Golf Outing that is coming up. We are sponsoring Creekside in Gahanna. We are sponsoring the Taste of New Albany, which is happening in a couple of weeks. And so just getting back in the district and reaching back out to folks and seeing what we can do to help the district and just to, hear from people if there's anything we can do for them.
Great. Sounds great. And just jumping right into some legislation you're working on, House Bill 98 is a piece of legislation that centers on veterans. It's a great cause. How did this legislation originate, and why did you decide to sponsor it?
This is a great piece of legislation. It's one of the ones I'm most proud of. In the last General Assembly, we had a physician assistant who served in the military and had gained all the experience and expertise performing as a physician assistant. When he came back to the United States, in order for him to continue to work as a physician assistant, he was going to have to go through all the licensure all over again. And he had already received the training. So what House Bill 98 does, it allows for those that have received education while deployed in the military, the expertise while deployed in the military, to transfer that experience, and allows the boards and agencies to go ahead and grant them a licensure in whatever particular area they happen to gain that experience and education. So it's really a great piece of legislation. Helps our veterans when they come back home to transition into civilian employment. And with so many coming back, it's just important that we help those individuals as much as we can because they have, helped us, giving us the freedom that we enjoy so much. So.
And you kind of touched on this, but I know we've all heard the stories of men and women coming home and having a little bit of trouble getting back into just normal life, jobs, careers, all of that. Exactly how does this help the process a little bit more for them?
So let's say that there's a veteran that learned how to drive heavy equipment while deployed. And so when that individual comes back, to the United States, comes back to Ohio, it would allow them to take that experience and have the agency grant them like a commercial driver's license. And it includes sanitarians, it includes individuals that have that HVAC contracting experience that they gained in the military to allow them to come here and just automatically receive that license so they can get into employment, find jobs, and just get back to work. So it's a good piece of legislation, well deserved for those individuals.
Great. And just some other legislation that you're working on. House Bill 23 goes along with women's health, which is something you seem to be very passionate about. It brings awareness to ovarian cancer. And I recently learned that 1 in 72 women will develop ovarian cancer, and that it's the 10th most common cancer for women. So how is this bill bringing awareness, and how is it aiding the research of ovarian cancer?
I got to give a little background on this bill because this one's very heartwarming to me. Most of my pieces of legislation come from my district. And this particular one came from a constituent in Gahanna, Bill Kramer, who lost his daughter at a young age to ovarian cancer. And he called me several months ago, and we sat down, had a meeting, and he said, I want to set up a fund for research and development here in Ohio about ovarian cancer, because he had lost his daughter to ovarian cancer. And so what this allows is when you purchase a license plate, $25 goes into the Cheryl Kramer Fund for Research and Development of Ovarian Cancer, and also brings awareness to the issue. And it's throughout Ohio. It's not just Central Ohio based. This is for all research and development throughout our state.
So staying on the issue of health, you also sponsored House Bill 123, which discusses telehealth, which is something you're a big proponent of. Can you explain a little bit what telehealth is and how it's really impacting the medical industry?
House Bill 123 is a great piece of legislation that is going to be cost-saving to all Ohioans as it relates to Medicaid expenses. And what this allows for is when an individual comes into the emergency room, there is what is called telehealth spots, and it's a cubicle. And they go in the cubicle instead of going into the urgent care facility or the emergency room. They sit down in this cubicle, and through Skype, a doctor from home Skypes in and is able to make a diagnosis of what the patient may have, whether it's a cold or an earache, and it's a cost-saving measure because it allows for the reimbursement. So you're not it's very expensive to go through the emergency room. And this is just more cost-saving to be able to give a diagnosis through telecommunication devices like Skype, like cable, like internet, computers. And Ohio State University is doing this now. The Cleveland Clinic is, and university hospitals are also doing this. So it's a really up-and-coming piece of legislation. It's up-and-coming way to provide health care to individuals that are even in rural districts who don't have the ability to get to an ER, or there's a shortage of doctors in a rural area. Being able to give a diagnosis, to treat patients through telecommunication devices while saving money is just, it's really a good idea.
And how did you
piece of legislation.
How did you hear about the legislation? How did you get involved with telehealth?
I was working with Director McCarthy, who is the director of Medicaid here in Ohio. And because I'm Vice Chair of Health and Aging, I'm also Chair of Health and Human Services. We were discussing, what are some cost-saving measures that we can do in the Medicaid system. And he and I were talking about, OSU using this telehealth, system, and how can we expand that? Does that actually save money? And we found out it did. So we just needed to create legislation to allow for that reimbursement and that activity to occur.
Great. And rounding out our discussion on health, you have also introduced House Bill 139. Can you summarize the bill and why it's important?
And once again, this really focuses on quality of care. This allows physician assistants and applied practical nurses to admit patients to the hospital. I've discovered, touring hospitals throughout Ohio, that there was an issue of wait time, that sometimes there's a problem getting a patient admitted for various reasons. And so this allows for quicker access to care, provides quicker comfort to a patient, to allow physician assistants and APNs to admit patients to the hospital. And then the bill requires that once the admitting is done, that they have to notify the doctor within so many hours of that admittance. So really it's just increasing the quality of care and providing comfort to a patient as fast as we can.
Great. And how else do you think it'll impact urgent care specifically and patients as well?
I think it's going to reduce wait time in the emergency rooms, which we're seeing quite, in some hospitals, wait time's not bad at all, and sometimes they're very busy. So this just, will reduce that wait time. And I'm also working on a piece of legislation to allow for, physicians' assistants, to expand their scope of practice. So that's in the works right now. We're working with the Ohio State Medical Association on that issue, trying to see what we can do to improve quality of care, which is a #1 priority here in Ohio, And it's going to be a pretty good fall, I think. When we get back to the legislature, we're going to be busy.
Great. Is there anything else you're looking forward to in the fall as far as legislation or anything like that?
I'm just, looking forward to getting back to work and getting back down here at the State House, getting these pieces of legislation moving. Definitely looking forward to that.
Great.
Yeah.
Well, thank you so much for joining us today. I know you've got a very busy schedule.
Yeah, and if there's anything that we can do for anyone in our district, please give us a call. My office number is 466-4847. I have two great staffers, Chris and Micah. They're wonderful kids. I get to call them kids because they're so much younger than I am. But they're wonderful. They're very helpful. They help run that office. It runs so smoothly because of both of those individuals. And then I always give out my cell phone number if someone wants to reach me, and that number is 354-4034. So be happy to help out anyone in our district.
Great. Well, thank you very much,
Okay,
Representative.
thanks, Carolyn.
It was great meeting with you today.
Yeah, nice meeting you too.
We look forward to seeing you again on the next edition of Ohio in Focus, the program that brings state government to you. Thank you for joining us.